The sitting is resumed and it's time now for questions to the Minister of Health. I can advise members that questions 6, 8, 11, 13 and 15 have been withdrawn. I call Mark Durgan.
Thank you, Mr Deputy Speaker. Question number 1.
I thank the member. In response to steadily rising demand, the Northern Ireland Ambulance Service carried out an extensive demand and capacity review in 2017, which recommended a significant increase in the Northern Ireland Ambulance Service workforce and the introduction of a new clinical response model to introduce more effective performance targets and improve efficiency and safety. Implementing the new CRM is one of my department's transformation priorities and is a key enabler of the wider health service reform required to meet our long-term population health needs under delivering together. However, it is largely dependent on growing the paramedic workforce, and the full implementation will therefore require additional recruitment funding to recruit and train sufficient numbers of paramedics. The first key milestone in the CRM programme was achieved when NIAS introduced new evidence-based response targets, and that was done on the 12th of November 2019. While there are some initial improvements in response times to immediately life-threatening calls, overall performance across all call categories will not see sustained improvement until significant additional resources are in place. My department is currently reviewing a final draft outline business case for the required investment, which was received from NIAS in December 2021, and that will shortly be submitted for further consideration by the Department of Finance. While approval of the business case is entirely subject to additional recurrent funding, the funding required to deliver CRM was introduced within my department's additional funding requirements as part of the Budget 2022-25 exercise. And as Health Minister, I remain extremely concerned about the current uncertainty over the 3-year budget planning exercise due to the absence of a functioning executive and the potential delay this is likely to have on key programmes such as CRM. This will undoubtedly affect patient care, and it is vital that clarity on the budget is given as soon as possible. In the meantime, Northern Ireland Ambulance Service continues to recruit and train as many staff as possible within the available resources and to prioritise calls in line with the new CRM.
And I call Mark Durgan for supplementary.
Thank the Minister for his answer and welcome any progress in this area. However, the sad reality is that people and places haven't seen the improvement to date, where some areas you might have to wait up to 3 times as long as the actual target time for an ambulance to arrive. That's completely unacceptable. If it was a Domino's pizza, it's just beyond the pale. If it's someone waiting for hospital treatment, someone whose life
come to the question?
is at risk. Can the Minister outline in terms of the resource required how much that is and where we are at in terms of securing it?
I thank the member, and I hope he was trying to be flippant when he was trying to refer to the Northern Ireland Ambulance Service to Domino's Pizza and wasn't undermining the staff that are doing an amazing job within our ambulance service. Because firstly, I want to recognise the hard work and the commitment of NIAS staff, particularly in the past 2 years, who in common with other areas of the health service are facing increasing demands on their services and challenging achieving targets. Because even prior to COVID-19, NIAS had been experiencing steadily rising demand without that matching investment, and this has made it increasingly challenging to meet performance targets consistently across all categories. And this was the rationale behind the development of a new CRM, which ultimately aims to put in place a much more resilient workforce, sustained performance against response times targets in the longer term. So in the past 2 years, these pressures have increased due to higher rates of staff absence, the number of staff vacancies and the ongoing issues with lengthy patient handovers. These handover issues are linked to a lack of capacity and patient flow right across our system. But in the meantime, I'm aware that NIAS are recruiting and training as many additional staff as possible within the available resources and have diverted considerable resource from their non-emergency transport service into the accident and emergency response. And the assistance of voluntary and private ambulance services has been key in freeing NIAS resources to respond to life-threatening or serious calls by providing crews to respond to low-acuity calls. I understand that while crews respond to calls, ambulance service call handlers, including highly skilled paramedics, are available to provide telephone advice to callers.
I call Orlia Flynn.
Gormiagat, Alas Canqualia, I thank the Minister for his answer, and I do think it's fair to say that the response times for ambulances are actually an emergency in themselves at the moment, particularly in our rural areas. And Minister, while I do understand the logic of the co-responding with the fire service, can the Minister explain why some of the legal and workforce issues weren't addressed before that particular announcement was made? Thank you.
In regards to what was addressed as Maggie's call, there was ongoing engagement in regards with the Fire and Rescue Service Board and the main union in regards to that. We were in a position actually to go ahead with the Carnlough station as the first responder to Maggie's call, and that was supported by the workforce in that station and joint working between both NIFRS Board and NIAS Board as well. So those concerns were addressed at that point, and additional concern has been addressed by the Fire Brigade Union, I think at a head office level rather than the local level.
I call Alan Chambers.
Thank you, Deputy Speaker. A paramedic's work can be challenging both physically and emotionally, and indeed even comes with a little bit of danger. Does the Minister agree with me, however, that Northern Ireland is fortunate to have the number and calibre of student paramedics coming forward that we do?
And I thank the member for the point. I actually visited with Northern Ireland Ambulance Service towards the end of last week in regards to, it was the last cohort of their internally trained paramedics coming through, and their enthusiasm, their commitment, their desire to be part of the NIAS workforce, I think was a credit to them, their trainers, but also the service in itself in regards to the investment that they're making personally to supporting the people of Northern Ireland.
I call John Blair.
Thank you, Mr Deputy Speaker, and thank the Minister for the detail provided already. And we touched on the issue of interagency approach a question or two ago. But can I ask the Minister if he can give a broader update on emergency service reform, including interlinkages between first response services to include, for example, cardiac arrest response?
And I thank the member, and I think he is touching on what the initiative that has been referred to as Maggie's Call in relation to what we've been able to do in Carnlough Station initially. Where we've seen Northern Ireland Ambulance Service, Northern Ireland Fire and Rescue Service actually coming together in response to that cardiac call. That had been a system that had been progressed to a point where we could launch it in Carnlough. It's something that I would like to see rolled out across all our stations, both retained and full-time, so that we do see the blue light services of ambulance and fire brigade working hand in hand, especially in those areas where they can, the likes of cardiac response. So it's the start of what I think can be a development. One of the benefits that we have here in Northern Ireland is actually Northern Ireland Fire and Rescue Service being under the health portfolio, and that's an advantage that many of the other areas or devolved nations that don't have. So we can actually see that co-working coming together a lot more efficiently, and I would like to see what is the initiative referred to Maggie's Call rolled out as soon as possible.
Moving on, I call Jerry Kelly.
Thank the Minister for his answers up to now.
Which question number?
I
thank the member for his question and his enthusiasm. For over 3 decades, the European Social Fund programme, funded by the European Commission, has been a key source of funding for disadvantaged people, and that includes the long-term unemployed, ex-offenders, young people not in education, employment or training, and people with a disability. The ESF has enabled people with a wide range of disabilities to access and stay in supported employment, and this has helped trusts to meet their strategic priorities as set out in the draft programme for government framework and related regional health and social care service delivery models. The fund has been due to finish at the end of March 2022. However, the programme has been extended under ESF Call 3, actually up until the 31st of March 2023, and that's dependent on organisations securing the necessary match funding. Beyond this, arrangement post-ESF remains unclear, and that includes the role of the UK Shared Prosperity Fund as its replacement. The total value of ESF projects has specifically supported the disability sector in the region of 15.6 million, and that supported 21 individual projects. Most projects have sufficient match funding in place to proceed post the 1st of April 2022. However, I understand that a small number still have match funding gaps. All have a minimum of 81% of the funding in place, and could be scaled back if absolutely necessary. It's the Finance Minister who leads on fiscal policy and negotiation of EU replacement funding with the UK Government, and my officials continue to engage with the Department of Finance and Whitehall colleagues to ensure that the UK Shared Prosperity Fund will replace funding gaps created when the ESF ends. Officials continue to proactively engage with the Department for levelling up housing and communities through established channels on this issue, and we will continue to make representation through the Department of Finance.
And I call Jerry Kelly for supplementary.
Apologies for my enthusiasm, especially after 20 years. And I thank the Minister for his answer up tonight, and you give some comprehensive rundown on some of the funding that's there. But I mean, after the recklessness of Brexit, there is still harm being done to services and communities. There's the recent loss of funding from the European Social Fund, and countless other services are at risk of closing. But ask the Minister, is he is engaging obviously with Westminster, and he's engaging with others, but is he engaging with the services that are involved, especially those that are in danger of being closed in the short term?
And I thank the member for his additional question, and I think at the end of my initial answer to him, I did point out that it's actually the Finance Minister that's leading in the negotiations and the fiscal policy in regards to EU replacement funding, and my department continues supportive of the work that has been done there. In regards to UK Shared Prosperity Fund being able to match the required funding and the infrastructure models that was previously met, there has been minimal information shared on the Shared Prosperity Fund, and while the Levelling Up White Paper was published in February 22, it lacks any confirmation of the quantum of funding for here to replace that 80 million per year. And as I've said, the Finance Minister is leading on that work. We haven't had any direct engagements because in regards to the organisations being funded through yourselves or through ESF, which is not a fund that is directly handled or managed by my department.
Moving on, could we have Claire Sugden onto our screens?
Thank you, Deputy Speaker.
And I call Claire Sugden.
Thank you, Deputy Speaker. Question number 3.
I thank the member. GPs are often the first point of contact for many people seeking diagnosis, treatment and support, and they play an important role in promoting health and well-being, supporting people to manage long-term conditions and coordinating patient care across specialities and sectors. They have also played a significant role in our response to the pandemic, and this has included operating primary care COVID centres, as well as undertaking an extended flu vaccination programme and playing a key role in the rollout of the COVID-19 vaccine programme. The General Medical Services Contract sets out the core elements of what GPs must provide to their patients, and it is an agreed contract covering all 4 nations of the United Kingdom. However, there is scope for optional and enhanced services to be negotiated annually in Northern Ireland between the Department of Health and the Northern Ireland General Practitioners Committee. This allows us in Northern Ireland to identify local priorities for increased focus each year, and under the Quality and Outcomes Framework, GP remuneration is tied to the provision of quality care against a range of clinical-based indicators. At the outset of the pandemic, the Health and Social Care Board negotiated with the Northern Ireland General Practitioners Committee and my department to stand down the QOF elements of the GMS contract, and that was to enable GPs where they were able to respond to the escalation of COVID by establishing COVID centres without suffering financial detriment. And I can confirm that my department has recently commenced engagement with GPC on the GMS contract for 22-23, and those negotiations are at an early stage. It is important to note, however, that GPs have continued to have a responsibility to provide core services to their registered patients, and that the pandemic has not in any way negated this requirement. The service has been working hard to make best use of available resources for everyone who is seeking to access the care that they need.
And I call Claire Sugden for supplementary.
I thank the Minister for his response. I think that was really helpful because I think there exists a misunderstanding about how GPs are managed, in that they are essentially private organisations that deliver an NHS contract. But Minister, as I'm sure you'll appreciate, the issue of accessing GP services across Northern Ireland is one that we as MLAs are regularly contacted about. And because it is so widespread, that would lead me to believe that it's a systemic issue. So I'll give you a hard question, given that it's probably your last question time. Is the shortage of GPs due to poor workforce planning of your department over 10 years?
And I thank the member for indicating this will probably be my last question or health question time of this mandate, and I'll miss it greatly. I can say in regards for workforce planning and training, I wouldn't put the blame at the feet of my department, but the challenge that has come over having 1 year, often non-recurrent budgets, that has made those challenges even more difficult. And I fully recognise that the need for additional GPs to be trained, and as such, my department with the Health and Social Care Board and other stakeholders has commenced work on reviewing the number of training places that are available in GPs or for GPs in Northern Ireland. And we've continued, and my department has continued to invest in our GP workforce, and has actually increased the number of GP trainees by over 70% from those 2015 levels. And there are presently 111 new training places available for GPs each year. And work is underway to review the number of GP training places, actually, and to ensure that we have the right number of GPs to meet our needs going forward. And that's a part of a wider piece of work my department is taking forward to explore options for meeting our GP workforce in the most cost-effective way. But it's important to note, however, that the increase in demand for primary care services cannot solely be met by increasing the number of GPs, and it's other elements that include the wider rollout of primary care multidisciplinary teams, as well as the introduction of advanced nurse practitioners and additional general practice nurses, all of which are making a difference to how services are delivered in primary care and contributing to improved patient outcomes.
And I call Colin Gildernew.
People do continue to struggle to get appointments to see their GP, and that's causing extreme anxiety in patients and putting additional pressure on services and on GPs, especially in local areas like Slick and Dromore, where there are particular issues bordering the Fermanagh South Tyrone, West Tyrone constituencies and the knock-on impact. Minister, will the people of Fermanagh South Tyrone and West Tyrone see extra health staff being deployed on the ground to support their GP in the rollout of their work?
And I think the member nearly set him up there by reference to MDTs, because I know that's something he has been pushing my officials at the last Health Committee. I hope to be in a position within the next week to actually state where that rollout will be. But in regards to GP services in the South West, which he did mention, I'm aware there has been significant GP workforce issues in the Western Trust area, particularly in the southern part, and the Health and Social Care Board has been engaging with practices across the South West area. And my department will continue to work closely with the Health and Social Care Board and GP representatives to consider how best to respond to the challenges which face general practices in Northern Ireland, and to ensure that we have a GP workforce in Northern Ireland that is supported, that's motivated, is sustainable, and continues to provide quality care to patients, because we want to encourage even more highly capable medical students to choose a career in general practice, and recognise that positive experiences during clinical placements can have a major influence on such decisions. So the commencement of the graduate entry programme at the Ulster University Medical School in Magee is a significant development in this regard, because the curriculum of this graduate entry programme places very significant emphasis on primary care placements, with a high concentration on clinical placements in rural settings in the West. And this will help ensure a supply of local students who wish to pursue a career in general practice in these areas. But other elements include the wider rollout, as I've said, of disciplinary teams, as well as the introduction of advanced nurse practitioners and additional general practice nurses, all of which are making a difference.
I call Pam Cameron.
Thank you, Mr Deputy Speaker, and I thank the Minister for Health for his answers. Could I ask the Minister what discussions he and his department have had with pharmacists to ascertain what role community pharmacy will play in aiding GP services, to assist GP services and to move transformation on healthcare forward, and will community pharmacy be included in the Encompass rollout next year?
I thank the member and I note her work as chair of the community pharmacy, all-party group as well, and the engagement that she continues to have. I met with the senior board and the senior office bearers of community pharmacy last week to engage about how we look actually to the next 3-year programme of work that they can do in partnership with us in the Department of Health, but also across the wider health sector as well. In regards to Encompass, the member will be aware, and I think the Health Committee is receiving an update on Encompass in the near future in regards to where it will be rolled out. The initial targets are across all health and social care settings before we look at the wider health family, and that includes community pharmacy, at what stage that will be feasible and cost effective. But the member will also be aware of something that we are looking at in the meantime, is that of e-prescriptions, so that they can be easily transferred across all health sectors and especially into community pharmacy.
And I call Colin McGrath.
Thank you very much, Mr Deputy Speaker. And I know the Minister loves question time so much, that's why I submitted an urgent oral question, and it's been accepted for later. But to continue with the theme of difficult questions, we submitted a priority written question back at the beginning of February, which was to be answered in 5 days, which was just asking about what percentage of the departmental budget is actually spent on general practice. Is that a difficult question to ask, or is it a piece of information that you might have to hand now?
It's not one I have to hand now, but I'll follow up for the member.
Moving on, I call Dolores Kelly.
Thank you, Deputy Speaker. Question 4, Minister.
And I thank the member for her question. I appreciate that this continues to be a worrying, uncertain time for anyone experiencing long COVID, and I would like to take this opportunity to reassure members that my department fully recognises the need to provide support to those who are dealing with longer-term health impacts as a result of COVID-19 infection. On the 1st of November 2021, I launched the first dedicated assessment and treatment service for post-COVID-19 syndrome in Northern Ireland. And these clinics allow people to have a comprehensive assessment of their condition and will help them access the services and expert advice that they need to support them in their recovery. Since then, and up to the end of January 2022, approximately 1,000 people aged 16 and over have been referred to the multidisciplinary assessment clinics across the region. And following consultation with paediatric specialists in Northern Ireland, the post-COVID-19 services have been designed for people 16 years of age and older, with the intention that children with persistent symptoms after a diagnosis of COVID who require more specialist assessment can be referred to trust paediatric services in the usual way. COVID-19 in children is usually of a short duration with relatively mild symptoms. However, I am aware that some children with COVID-19 experience prolonged illness duration, and that the impact upon them can be devastating. So the MDT clinic is one element of the suite of services that are being established for post-COVID-19 patients, and other elements will include bespoke pulmonary rehabilitation, dysfunctional breathing service for patients with significant respiratory symptoms post-COVID-19, additional support for patients discharged from clinical care, both COVID-19 and non-COVID-19, strengthened psychology support to all trusts, and signposting and access of self-management resources.
I call Dolores Kelly for supplementary.
Thank you for your answer, Minister. And you rightly outlined a lot of medical or therapeutic interventions, but there are many children suffering post-traumatic stress type symptoms, or indeed social isolation as a consequence. And I watched a programme at the weekend where some children were being helped actually by a charity in partnership with a riding school in terms of that therapeutic intervention used with pets. I just wondered, Minister, will there be enough flexibility and financial support to trust to allow for that imaginative type partnership to deal with that specific type of impact of long COVID with children?
And I thank the member. The point she makes is one in regards to those mental health supports that have been in place, and the member will be aware that's why I established the Mental Health Support Fund as well, because they are doing, and the charities and vulnerable and community sector are actually utilising that money to support individuals across society in a wide range of services as well. And I visited some equine support services which are providing a great value to those patients that are using it as well. I'm not specifically aware of the pet intervention that the member mentions, but in regards to resources, when I did launch that dedicated assessment treatment service back in November of last year, it was in recognition of the immediate needs to establish these very important services. At that point, I made £1 million funding available for 21-22, and a bid to maintain those services has also been made as part of the budget process for the next 3 financial years, 22-23, 24-25. And then about the imaginative additional ones, we'll look how that can best intertwine and then work with the main core delivery while we work in partnership with the voluntary community sector. And the member will be aware from the mental health strategy that that's actually a core focus of that as well, how we work with our third sector partners as well to improve service.
I call Carla Killen.
Agad las Cancolia, going by his lesson as a Frager. Thank you very much to the Minister for his response to Dolores. Question I have is in relation to Minister's outlined the role of the MDTs and indeed the psychological and mental health support services. Can the Minister give everyone here an assurance that there won't be a postcode lottery, because getting access to MDT clinics, if they exist, and indeed getting onto the waiting list, particularly for CAMS and adult services and mental health as it is really, really difficult? Gormagat.
I thank the member and acknowledge the point she's made. In regards to MDTs, there will be a further announcement of the next steps where we intend to roll those out. But as I said, I think in this chamber last week or the week before, that will be dependent on workforce and a commitment for financing over the next 3 years. And the same applies for CAMS. One of the things under the mental health strategy is that regional approach that we need to take to mental health when we reform it, so there isn't a postcode lottery. Because since coming into this post, it's something that I've been trying to make sure there's not across Northern Ireland, especially when we look to rebuild services, should that be surgical or medical or mental health supports as well. In regards to the establishment of long COVID clinics, all trusts are progressing at significant pace. We are seeing a slight delay in the establishment of our COVID clinics in the Western Trust, but that should not hamper the support available for patients.
I call Paula Bradshaw.
Thank you, Deputy Speaker. Minister, recently there I met with some long COVID patients on an online meeting, and at that meeting there was raised the issue of the lack of support for children who are living with this, and I saw some really harrowing footage of it. So I really appreciate what you've said today, and I hope that there is rapid progress in engaging with young people and providing them a service. My question is, how is your department actually reaching out to other parts of these islands and further to engage in clinical trials? Because there are some very sick children who would benefit from some advancement in the medical treatment for long COVID. Thank you.
And I thank the member, and I think she will be aware too, I'm not sure if she's directly referring to it, but about those standards and outcomes and practices that have actually been developed in Germany, which are actually already being accessed by some patients in Northern Ireland. And it's through the National Institute of Health and Care Excellence who are responsible for providing that evidence-based guidance and advice for health, public health and social care partners. And our post-COVID-19 services in Northern Ireland have been actually designed in line with that NICE guidance on managing the long-term effects, which actually covers those identifying, assessing and managing the long-term effects of COVID. So long COVID services in Northern Ireland will be continually reviewed and updated in line with any updates on NICE guidance, and that will be for both adults and young people as well, as to what are safe and effective treatments for those post-COVID-19 patients.
Moving on, I call Mervyn Story.
Question number 5, Mr Deputy Speaker.
And I thank the member for his question. Within the Northern Health and Social Care Trust, currently all income received from parking charges is used for the operational upkeep of the car parking facilities. That includes maintenance costs of parking assets, which is barriers, pay stations, CCTV, and the removal of this income will require maintenance costs for car parks to be sourced from alternative trust funds, and that will result in additional resourcing pressures and an inevitable impact on patient services. Funding sourced from car parks also enhances security on acute hospital sites and provides a car parking team with CCTV retrieval service as well as car park patrolling function on the Antrim area and Causeway hospital sites. Should this service be removed due to insufficient funding, this team of staff would have to be redeployed into the Corporate Support Services Department. So free car parking not only will lead to a loss of income, but there is potential for car park spaces, particularly on some hospital sites, to be used by commuters and staff as a park and ride facility. Patients and other service users may therefore be denied spaces when they're attending appointments of sick relatives. This particular issue has presented challenges to car parking provision on a number of hospital sites, and that there's also a number of hospital sites within the Northern Cross that currently do not charge for car parking, such as White Abbey and Moyle hospitals.
I call Member Story for supplementary.
Yeah, thank you, Mr. Deputy Speaker. Thank the Minister for his answer. And as this is possibly his last question time as Minister of Health, as a colleague in Northampton, I want to wish him well in the up-and-coming election, and look forward, no doubt, to meeting him, I'm sure, in the roads and the
can
area
you come
in
to your question,
Northampton.
please?
Could the Minister maybe explain or give us some outline? He has mentioned the issue in regards to the deficit in the funding. Does this mean that we will now be in a situation as a result of the imposition of this legislation that instead of having money and the car parks being managed, it will be a free-for-all, and it will undoubtedly lead to a situation where there could be chaos at our car parks and our hospitals, as opposed to a situation where they're currently managed and revenue generated from them?
And I thank the member, and again I do look forward to those engagements across Northampton, because they've always been engaging and positive, unlike some other constituents, colleagues that we have as well. I wasn't mean. I didn't mean no, Jim. I didn't mean you. Don't take that personally now. Look, in regards, and I think the member has reference, and it is reference to the hospital parking charges private members bill. I have raised a number of concerns, as have my department staff and has trust officials, with the Health Committee and with the bill sponsors. I tabled a number of amendments at the last stage, which unfortunately weren't taken in full, which would have went some way to address the concerns that we have from a department and trust point of view. And I think that the bill sponsor could have been accepting of, but we've actually tabled further amendments, which will see a time phase to allow trusts and the department to introduce car parking charges and the private members' bill intention, because it's a policy that we would, or I would, share in regards to making sure that those who need car parking aren't penalised in any way, but also to ensure that it's not abused. And I hope we can meet in willingness with the bill sponsor. I know it's something that has been picked up from initially with Fran McCann tabling a private member's bill in regards to that. So I think it's something that progress can still be made on that actually benefits the patients, visitors and the trust as well, because I think there's a piece of work that can be done in partnership with the bill sponsor and the department and trusts.
And that is our end of period of time for listed questions, and we now move on to topical questions. Can I advise members that topical question number 9 has been withdrawn? I call Patsy McGlone.
Much, Mr. Deputy Speaker. Could I ask the Minister, last June the figures that were given to us were that there were 184,000 people waiting more than a year for the first hospital outpatient appointment, and a further 66,000 patients waiting more than a year for surgery or hospital treatment. Now, at that time last June, there was an announcement made of a 700 million roadmap to be introduced to help to start address these lists. Can the Minister give us any indication on progress in that regard, please?
And I thank the member for his point. And again, the elective care framework that I announced at that time came with a £707.5 million actually over a 5-year period. We were able to secure funding for the first year. The number of initiatives that were already launched and actually are underway included the introduction of mega clinics to maximise patient throughput, outpatient assessment delivered by GP federations in primary care settings, a regional retention initiative for nurses and midwives, recurrent and significant use of the independent sector, the development of an in-house health and social care capacity, and that included a workforce appeal and continued investment in staffing, and the implementation of green pathways and sites. Also in the elective care framework was the day procedure centre at Lagan Valley Hospital, and that's working extremely well, supporting a range of specialities from across the region to undertake the most urgent clinical cases. We've also looked at opportunities to deliver more elective surgery on a regional basis and are currently exploring other units across the health and social care service. These initiatives, which were aligned or are aligned with the elective care framework that I published, actually set out a 5-year plan which was intended and will systemically tackle the backlog of patients waiting. I published an interim progress report on the actions in the elective care framework back on the 24th of February, but that also recognises the additionality of non-recurrent funding which was made available in 21-22, was targeted at those patients initially. And unfortunately, because we don't have an agreed budget in place, there remains a great deal of uncertainty around the implementation of the framework and a great deal of uncertainty for those patients who are currently waiting.
I call Patsy McGlone for supplementary.
Thank you, and I thank the Minister for his answer. Can the Minister specifically add or clarify if, in fact, those numbers, the 184,000 and the 66,000, that were the figures from last year, if in fact those measures, that £707 million, is starting to make a dent or reduce those figures, and if so, by significantly how much?
I can give the member figures as of the 31st of December if he wants to make the comparison. 147,878 patients were waiting for a diagnostic service. 83,643 were waiting more than 9 weeks for a diagnostic test, and 49,632 were waiting more than 26 weeks. 120,097 patients were waiting for inpatient day case treatment. 97,850 were waiting more than 13 weeks. And 69,373 were waiting longer than 52 weeks. So while those initiatives that I have indicated are seeing us hold steady in regards to some of those figures, some are increasing, but it depends, and it shows how much these waiting list initiatives are actually needed as an additionality to what we're currently able to provide in-house.
And I call John Blair.
Mr Deputy Speaker, last month a potential major incident was declared at Antrim Area Hospital in my constituency. Can I ask the Minister what immediate action he is taking to address the current pressures being experienced by emergency departments across Northern Ireland?
I thank the member for his point. I know he says it's in his constituency, but I also know it borders on my own and is actually with a number of miles from my own home, so I'm fully aware of the pressures and the work that is undertaken in Antrim Area Hospital. In regards to the potential incident that was declared, it's not something that a trust or management team do lightly, but it was, I think, as some members of staff referred as that flare up to call and seek assistance. In regards to that, we have made a number of initiatives, especially over the last 18 months to 2 years, in regards to how we're seeing our emergency departments actually working together in regards to ambulance smoothing, where ambulances can be and are redirected to emergency departments should there be spare and available capacity. But that's something there's not a lot of in our emergency departments at the minute. So there is a major review of emergency medicine, and that review is due to be published very shortly as well. There is no quick fix to this, and I think no matter who you speak to across the medical professions will indicate this. This is about a long-term development and investment in not just our workforce, but also the facilities that we have, so that we can get on top of that 10 years of underinvestment both in facilities and workforce.
I call John Blair for supplementary.
Thank you, Deputy Speaker. I thank the Minister for that reply. I am grateful, Deputy Speaker, for the reviews being undertaken and the initiatives that are underway at the behest of the trusts. But can I ask, in addition to that, if all aspects are being addressed in relation to the pressures that are on emergency departments, for example, the issue of access to GPs, which has been mentioned here today a number of times, is that impact on emergency departments being considered actively currently by the Minister and the Department?
And I thank the member he did reference earlier on in regards to the specific point that was raised in regards to GPs and the work that they continue to do. And a number of times I've addressed in this House is that misconception or misperception in some cases that our GPs are closed. The member will know they're not, but I suppose it's a narrative that's out there that's been hard to address, but I would like to make sure that people are aware that there is access to GP services as necessary. Look, in recent figures actually in regards to access to GP services indicate that currently practice teams are carrying out approximately 200,000 consultations on a weekly basis, and feedback from our GPs indicate that many patients are presenting with more complex needs, particularly those who have a chronic disease, making it more difficult for GPs to see all the people that they would wish to see. So it's not about one part of the health service putting pressure on another part. It's all under pressure at the moment. because there's no spare capacity within our service that we can readily divert to help elsewhere. But it's how, especially over the last 2 years, we've all seen it coming together and working as one health service, where we actually deliver for the people in Northern Ireland is challenging. The people working in our health service know the pressures they're under, but I've never seen a workforce, although tired and under pressure, that are more resilient now, especially as we come out of, again, this wave of COVID, about redressing and getting back to doing the work that they want to do.
I call Colin Gildenew.
Minister, the transformation of health and social care here is arguably the greatest challenge facing a future executive. Can the Minister confirm if you will make a decision on the duty of candour, stroke services or workforce planning before the end of the mandate?
I thank the member, and they're all major pieces of work that are currently either in the system or working their way towards my desk. In response to the duty of candour, I have received an initial response from the workforce, which I am currently considering in regards to what that can be. Whether I can make a decision on the fully informed decision between now and next Friday will be challenging in regards to what exactly has to be done, because I have further sureties to ascertain. In regards to stroke services, the member will be aware as well that I've asked for additional work to be done in regards to the numbers, because I think in the review of stroke services at the start didn't take into consideration fully the ageing population that we have in Northern Ireland. So there has been a number of developments that actually have been made in regards to stroke services, in regards to the accessibility of certain medications when it comes to stroke prevention or stroke reversal, as well in regards to how we actually support those patients. The third one, Colin, apologies. Workforce planning, again, is ongoing, and the member will know that we set out a number of initiatives in regards to the 2026 project, where there was to be 3 yearly reports. The one that was due during this particular period has been stalled due to COVID, but that of workforce planning in regards to additional nursing training places and the additional places and investment that we need to put in continues. And I would like to be in a place to make an announcement in regards to that, but I can't give surety to the member, and nor would I want to mislead the House at this point in time. But it's work that will continue, and if it's not done in this mandate, I can assure it will be ready for the next Health Minister, whoever that may be, come the 5th of May.
I call Colin Gildenew for supplementary.
And I thank the Minister for his answers to those. Minister, there have been very many sad and tragic moments over the past number of years as a result of COVID, but also, regrettably, we have seen throughout the health and care system various scandals that have rocked the system. Muckamore Abbey, Dunmurray Manor, Clifton House Nursing Home, urology, radiology and more. Given the need for clarity and answers for victims, Minister, can you confirm that you will publish the neurology report before you leave office?
I will do my utmost, and I think it's something the member has asked. I think at Health Committee, he mentioned the transparency and the challenge. The member will also be aware, since coming into office as Health Minister, I have announced public inquiries under the Public Inquiries Act into urology, into neurology, and into Muckamore Abbey especially, which work has already started on in the past week, and I would encourage people to interact with that team as well, because of those 3 inquiries, I think they all build on what we all want in this House, and that's people to be reassured that the service that they get is safe and is quality approved and consistent, should that be through all the different medical bodies, training colleges, all professional standards as well. So it is imperative that we get that reassurance and that trust back into the general population in Northern Ireland. So I'll not again make any commitments to the members that I can't promise today, but I'll write to him if I can by the end of the week in regards to the time frame on that specifically, because he has asked in the past.
I call Alex Easton.
Deputy Speaker, could I ask the Minister how important he considers the Independent Living Fund to be?
And I thank the member for his question. And actually, there was a very, again, good engagement between the Disabled People's Parliament and the Health Committee that the Health Committee actually facilitated last Thursday in regards to a number of issues, and that was actually the first question that was asked, so I'm not sure if the member had been watching or was just intuitive in regards to that. But the Independent Living Fund is essential, it's beneficial, and I think as the Health Committee heard, and I heard, and I've heard it previously, about the independence, and it's in the name about how that allows people with disabilities actually to live independently, support themselves independently, but also the importance that during the COVID pandemic, where they were able to be assured of the support that they were getting, because it was services and individuals who they themselves were actually employing directly. So I place a great value in the Independent Living Fund, but again, in regards to the challenges that are currently there of a recurrent budget, where I would like to do more at this point in time, unfortunately I'm not able to confirm that.
And I call Alex Easton for supplementary.
Thank you, Mr Deputy Speaker, and thank the Minister for his answer. Minister, I know the Permanent Secretary hasn't given any paperwork back to him yet. Will he be launching a consultation on the Independent Living Fund over the next week or two to possibly look at reopening for new applicants in the future before he goes out of office?
I'm not aware of anything that's due to come to me between now and next Friday in regards to launching a consultation on ILF. But again, if there is something, I will confirm it to the member in writing if there is something that's already in preparation in regards to that.
And I call Sinead Ennis.
Mr Deputy Speaker. Minister, families who rely on day centres and respite services really feel like they've been left behind as COVID restrictions have eased. And I know you announced in January that trusts were instructed to reopen these services, but some families are still waiting for this crucial help to finally reopen. So can you state when services will finally resume for respite and day care centres?
And I thank the member for the point. I think at the last question time there was actually further clarification in regards to that, in regards to the targets that had been specifically identified by a number of trusts and how they plan to step up those respite and daycare facilities. Some trusts more ambitious than others, but I had asked that all trusts actually publish their rebuilding plans actually on the department's website in regards to the speed that they will be working at. But as the member has indicated, I made it very clear that my expectation of our trusts that they were to get those facilities back up and running to full capacity as soon as was safe and practicable for them to do.
And that is the end of our period of time for questions to the Minister of Health. I would ask members to take their ease for our next item, which is questions to the Commission.
Members, we now move on to questions to the Assembly Commission. Questions 4 and 8 have been withdrawn. I therefore call Mike Nesbitt.